Hello parents, I hope all of you are doing well. I am Dr. Poonam Sidana. I am the pediatrician and neonatologist head of department at CK Birla Hospital, Delhi. So today I'll be talking about the importance of follow-up of your newborn baby after the baby is discharged from the hospital. So जब बेबी प्रेगनेंसी के ड्यूरिंग जो होता है बेबी का ऑल द फंक्शंस किडनी ब्रीदिंग न्यूट्रिशन एवरीथिंग इज बीइंग डन थ्रू द मदर्स प्लेसेंटा but when the baby comes out there has to be a sudden switch. The lungs have to start functioning, the liver, baby should be able to start feeding, doing everything by himself. So most of the babies are in hospital for 48 to 72 hours, which gives us the opportunity to see that baby is making a smooth transition. बट सारी चीज़ें कंप्लीट नहीं होती हैं. सो जैसे आपने को पता है बेबीज़ विद मे हैव जॉन्डिस, दे मे हैव फीडिंग डिफ़िकल्टीज और दे कुड बी अदर इश्यूज़. So which makes it very important that when your baby is discharged from the hospital, you read your instructions very carefully as given in the discharge summary, and whatever is being explained to you by the doctor and the nurse at the time of discharge. Make sure you save all the important phone numbers, the contact numbers, the emergency numbers. Like in our department, we have a pediatric hotline, which is where a pediatrician is available 24/7. So during your follow-up, baby's follow-up in the next 7 to 10 days, depending upon कि baby आपका premature है या low birth weight है या कोई और risk factor है, there are generally 1 or 2 follow-ups in the first couple of weeks. The first follow-up is usually not later than 72 hours, 48 to 72 hours. So we check your baby's weight to make sure that there is no excessive loss or whether the regain has started. We want the baby to be back to birth weight by about 10 to 14 days, depending upon the maturity level. Also there could be feeding difficulties, especially with the first time mothers, whether the baby and mother have bonded well and they are baby is able to feed adequately, urine output is all right or not. In some babies there is a higher risk of prolonged jaundice, especially if the mother's blood group is O and baby is A or B. You have to be very careful. Many of these babies can have jaundice for a prolonged period, which needs to be picked up timely and treated. Otherwise it has bad consequences in the long run. Right? In some babies the thyroid test may need to be repeated. For most of our babies we do it at birth, but some babies it may need to be repeated or it has been missed out. Also there are many heart diseases which may not be manifest at the time of birth, or some other things which might manifest in the next few days. So it's a very good and very safe practice to make sure that you bring your baby back for follow-up 48 to 72 hours after discharge, or sometime it may be even 24 hours, especially if the baby has borderline jaundice. And if there is any feeding issue, any weight gain issue, or doctor finds some other problem, they may ask you to come back again after a few days. Subsequent follow-ups are usually every month, which coincide with your vaccination visits, where the doctor will check out baby's growth as well as development and timely advise on feed changes and other things. So please make sure on every visit you understand the next follow-up and follow it properly. Have a good life.